Hey there, Richard Wolf, Grace Agency, coming to you to give you a quick video on Medicare and its parts. Today, we're going to be talking about Part C of Medicare, or what's commonly called Medicare Advantage or Medicare Health Plans. In a previous video, we talked about Medicare Part A, Part B. That's original Medicare, and that's what that is. That's your major health insurance. Part C is a third part of Medicare, and this is the part in which, if you choose, you allow a private company to manage Medicare for you. Now, if you do that, it's a great option for a lot of people. I have a lot of my customers on these type of plans. One of the bigger considerations I believe that you really need to start thinking about is what type of Part C Medicare Advantage plan do I think is best for me? And by type, I mean one of two options. HMO, Health Maintenance Organization, or PPO, Preferred Provider Organization. Those are your two big options. Now, there are a few areas that have a private fee-for-service plan, which is kind of a bit of a hybrid, but there's not many of those in the areas I work in that might be watching this video. And if there is, we'll dig into those details for you. But these are your two basic optional plans. So how do I look at these? Well, an HMO says there's a defined network of providers. If you stay in this network and you use the folks in this network, doctors, hospitals, pharmacies, therapy, all that stuff, we'll give you a very controlled flat copay for your services. However, if you decide on your own to go outside the network, you're going to pick up all of the cost. In some cases, this could be some big dollars. Now, there are some exceptions in which if you ask the plan to cover a particular doctor and they approve it before you go see them, then it can be cost structured as if you're in the plan, okay? The second option that a lot of people like is what's called a PPO plan. And I draw the circle like this mostly because many times, not always of course, if they're in an HMO plan, they're also in the PPO plan with that company. But it's a much bigger network of folks you can see. More doctors will be in a PPO than an HMO in many cases. Again, not exclusively and not all the time, but many times. But on a PPO, if you go out of the network, it's okay. But you will pay more when you go outside the network. Maybe it goes from a $40 copay to a $50 copay, or maybe it goes from 20% cost to a 35 or 40% cost. It depends on the plan and the market, area, zip code, and all the way it's structured. But these are your two big first point considerations. Should I use an HMO? Should I use a PPO? And a PPO plan will always give you more flexibility, without question. Now, depending on the area you're in, you may have the opportunity to have a zero premium PPO plan. What'd you say, Richard? Zero premium? You mean it's free? No. We don't say free. In a Medicare Advantage world, you're still going to have to pay your Part B premium. Okay? Part B premium right now, 2021, is $148.50. So that doesn't change. You still have to have Part A and Part B to be enrolled in Part C. Part A doesn't have a cost. Part B has the $148.50. So you'll still pay that cost. But in addition to that, you will not pay a premium for the HMO and many of the PPO plans. Make sure you talk with an agent. I can help you there in your area that can help you. I'm licensed in several states. If you're looking at this video, reach out to me because I can probably help you. But we'll sit down and go over the options and differences and let you understand what you figure out is best for you based on all the research that we've done to help save you time, energy, and effort. And hopefully some dollars as well. So HMO or PPO is your first consideration because there are networks of providers. If you're not using the right networks and providers, you could have more cost or pay all the costs. Make sure that's real clear. Now, the other thing that is nice about Part C of Medicare that a lot of people like is the fact that it also covers your prescription drugs. Okay? So you don't have to go out and get a separate Part D plan to go along with Medicare Advantage because it's already included. Now, there are some plans that do not have prescription coverage. Those are very unique for certain individuals and may be right for you, may not. We can talk about that and get the details. But most people need a prescription plan to avoid a penalty and to get their drugs for, usually it goes from $0 to maybe $10 for your generics, and anywhere from $47 to maybe $100 for your brand name drugs. Okay? So, very controlled costs. So, the couple of considerations in this world, though, is what drugs am I taking? What doctors do I see and that I tell myself I do not want to give up? And how does that play into the networks and the list of drugs that's on that formulary? Because then that will guide your cost in accordance to that. Now, the last piece I want to share with you about the Medicare Advantage option is that possibly a $0 monthly premium, okay? Most likely $0 deductible, and then you'll have copays based on the services you use. Might be $5 for a primary care provider, $40 for a specialist, $90 if you go to the emergency room. Could be a little bit more if you have an MRI. Could be like $250 MRI. So you have a cost associated with each and every service you receive through the Medicare system. Okay? The company is paying the provider a flat fee for that service, and then you have a copay to make up a little bit of the difference. That's the easy way to understand that. And then the other thing that people like, so it's a very controlled cost. They know exactly what it's going to be for that service they're going to get. The other thing people like about the Medicare Advantage plans many times are the extras. You're going to have some dental benefit, some vision, some over-the-counter, and then probably a health club membership. All for the low, low price of $0 monthly premium. Again, not free, because you are still paying your Part B premium. You're just not paying anything extra to the company. Again, this is Part C of Medicare. Be sure you visit with a licensed rep that knows your area, that can do the research for your area, for your doctors, for your prescriptions, for your needs specifically, to make sure that you are covered as well as you want to be covered, and that you're maximizing the dollars that you are spending, whether it be copays or in premiums. In another video, we're going to talk more about the Medicare supplements, how they come into play, and how they work alongside of Medicare and a prescription drug plan. So reach out if I can help. Richard Wolf, Grace Agency, 337-322-0415, or email at rw@graceagency.org. Thanks for listening, and we'll see you on the flip side.